My name is Lauren D'Amato, and I am the vice president of our PEBBL Research Lab at Bierman Autism Centers. Sorry, I've got like a hair on my face. I have been a BCBA since 2011. I have been with Bierman Autism Center since 2021. I was previously a regional director and director of service at Bierman, where I was able to help support the growth of our New Jersey locations from one back in 2021 all the way up to six, most recently, soon to be seven, in just a couple of months, opening another location. So, seeing lots of growth in our organization, which we're really excited about. And I was very, very fortunate to have the opportunity to kick off our new research lab department, which we started earlier this past year. So PEBBL stands for Progress Through Evidence-Based Behavior Lab, where we conduct research projects, where we are looking at everyday practices that are occurring within our centers with our clients, largely under the supervision and development of our board certified behavior analysts. And my goal in the research lab is to take the projects that they are doing, little case studies, little um, approaches to challenges that they are experiencing in their clinical work, and helping to create some experimental design structure around those case studies or A/B designs, or just them doing some good old analysis or literature review where they have a clinical challenge on their caseload and they take some type of innovative approach, and then I get wind of it and look to try to replicate it across our different centers or different clients who may be experiencing similar challenges, to see if we are able to find and demonstrate experimental control around the treatment or intervention approach that we're working on, and to see if we see a consistent impact on whatever the dependent variable is that we're looking at. Part of my mission is also to help integrate or help clinicians integrate experimental design procedures or foundational approaches into their clinical work, to try to break down some of the, I won't say barriers, but some of the silos maybe that sometimes exist between clinical work and research work, and try to integrate experimental design and research into our daily practice. So that's a little bit about my goals for our lab. I can't get this hair out of my face. And our progress lab. So when we launched earlier this year, again, May to June, we had some initial research focus areas that we started our research projects focusing on. So we have quite a few projects that are looking at outcomes, specifically looking at how we can maximize the outcomes for our clients. We are center-based ABA organization that also provides speech and occupational therapy. We do comprehensive level therapy, so all of our children are scheduled for usually between 30 to 40 hours per week of ABA therapy, where they may be receiving a bit less than that when we subtract naps and other related services. So for our clientele, they will usually be with us for approximately 2 to 3 years. And we are looking at ways that we can develop predictive models through the data that we already have collected through those day-to-day sessions, as it was noted on that previous slide. So we have oodles of data on age of therapy onset, initial VB map scores, Vineland, other assessments that we may do throughout the course of our treatment planning. We have treatment plans every 6 months, along with progress toward treatment plan goals, um, parent training, utilization, all types of outcomes or data for our clients' programming. So we are have a bunch of research projects that are all looking at which approaches may be best for certain types of student or learner profiles, such that we can maximize their outcomes. At Bierman, we do precision teaching and use the standard acceleration chart for our visual analysis and data-driven decisions. And so each time a behavior analyst should make a change to a learner's program that might be progressing it toward a treatment plan goal or a longer term goal than that. This in the precision teaching terminology would be referred to as a change harder. It may represent a new target or a new target set, a faded prompt, a faded reinforcement schedule, but something to progress that learner's behavior toward that longer term goal. So we're looking at which teaching approaches may result in maximizing those outcomes or those change harders and being able to make predictions. So how many change harders might we need to see to reach certain treatment plan goals, which teaching procedures, error lifts versus error correction, different reinforcement schedules, fading reinforcement schedules. How can we combine the hundreds of clients that we have and the thousands of data points that we have to be able to find correlations and then use those to make predictions to have the most efficient programming for each of our learners that we have within our organization? We also have projects relating to parent training and parent partnership and how parent involvement in turn impacts client outcomes and progress toward graduations and then next placement. So again, our learners are generally with us for 2 to 3 years, and then we are looking to be able to graduate them from our program and our training therapy model to a lesser restrictive environment. So our goal is to be able to make data-driven decisions around those graduations and predictions so that we can assist families ahead of time with those transitions into those next placements, whether it be special education, general education, with or without supports. As I mentioned, we are an ABA organization and also provide speech and occupational therapy. So we are looking to create, or we have created, some research projects in our speech and occupational departments. Similar to our ABA goals is maximizing client outcomes and looking how we can cross or collaborate across disciplines to maximize outcomes relating to potentially speech goals or speech behavior, collaborations between speech therapists and ABA therapists or behavior analysts, and similarly progress towards occupational goals by collaborating between ABA, speech, and occupational therapists. We have several projects relating to staff training, particularly integrating fluency-based instruction. As I mentioned, with our focus on precision teaching, we are looking to, or ways to maximize staff training and staff outcomes, in turn to impact our client outcomes through fluency-based teaching arrangements. So we have quite a few active projects. These represent, again, some of those initial areas of interest. We also have tech-enabled ABA, where we have been collaborating with organizations that integrate virtual reality, eye tracking, and apps that allow for stimulus presentations to learners in their sessions to see how they may that again may impact our client outcomes. So within the PEBBL lab, we have the participation from all of our full-time employees within the organization. And we have been fortunate enough to be able to hire some part-time employees to assist with some of our research activities. So, one of the roles that we have within the research lab is a research contributor. So, Kia was our first research contributor that we hired earlier this year. She has assisted with literature reviews, extracting information from articles that she's summarizing, as well as watching video recordings of them therapy sessions to score in terms of her agreement, procedural integrity, as well as assisting with the development of some projects that we have looking at stimulus control and concept formation. So for those that may be interested, and I'll explain in a minute about how you can submit an interest form. Our research contributors participate in a variety of research projects where, again, it may be, but not limited to data gathering, literature reviews, working on projects to assist with moving the research studies forward. They also attend our monthly research spotlight meetings where we host open to the public for free 30-minute CEU webinars or 30-minute webinars that are eligible for BCBA CEUs, where we highlight a particular project that we are doing within the organization presented by the researchers who are conducting the methodology or implementing the procedures so that they can talk firsthand about their experience within that project, which would allow for authorship for on internal presentations and dissemination within the organization. We also have a research fellowship. So our research fellowship are for individuals who may be interested in conducting or leading a research project where they may not have access to a certain population that they are interested in conducting their research project on, or potentially doing a research project under and receiving mentorship through Bierman, where we are able to assist with overseeing the methodology of that research project while the research fellow maintains a lead author or principal investigator role where they're developing the research project and overseeing the procedures being done. So, an output for our research fellowship, in addition to it being paid through Bierman, is to be able to develop a publishable paper or poster and being able to disseminate that information. Disseminating our research outcomes is another mission of our lab. We've most recently awarded our first research fellowship to Dr. Abdul Ghani, where she is going to be looking at comparing error correction procedures on skill acquisition as an extension of her dissertation. And we are quite excited for her to conduct that research within our organization so that we can, in turn, as I said earlier, continue to strive for maximizing client outcomes and determining treatment efficiencies so that our learners can benefit from the research that we're conducting in the field. By participating in the lab, again, both internal and, or I should say, full-time employees of Bierman that have been conducting research as part of their clinical work, or those that come straight into our lab will also have opportunities for dissemination at conferences where Bierman has sponsored the attendance and presentation of a variety of um, posters and presentations at local conferences such as Autism New Jersey. This was at OHABA. This was at Babbitt in Massachusetts. And this was most recently at AZABA. So we are quite proud to be able to assist with sponsoring the attendance and dissemination of the research being conducted at our organization by those who have firsthand developed or implemented the procedures so that they have practice and opportunity to both attend professional conferences, but also the dissemination to their colleagues. So if you have any questions, please feel free to hop into the chat and I didn't have it up, but yep, okay, there we go. Hop in the chat and let me know if any of this sounds like something that you may be interested in. Please feel free to fill out an interest form. So if you go to our website, Bierman Autism Centers, on the career tab, there should be a drop down that can bring you straight to our PEBBL Research Lab. And then once you get to the PEBBL research page, on the right-hand side here, you'll see a form to submit interest for participating in the lab as a fellow or as a contributor, in which you'll indicate the state, your contact information, state where you live, contact information, as well as primary research interests. And then that form will come straight to me, and I'll reach out to speak with you about your research background, your research interests, as well as answer any further questions that you may have. You may also certainly email me directly any questions. That's lauren.d'amato@beermanautism.com. Spots are limited. We are looking to fill our final few of fellowship and contributor spots over the next month or two. So please fill out that form if you may be interested. No commitment, but that will sort of open the conversation so I can reach out and see if that's something that you may be interested in participating. Thank you so much for your time.